right, welcome everybody. I'm Dave Bradbury. I'm president of the Vermont Center for Emerging Technologies here. So it's a real pleasure and treat to welcome Senator Welch and team and leaders from our community to talk about prescription drug costs and its impact on healthcare. At VSET, we work with over 300 startups a year all around Vermont. Our companies have now paid out payroll about $40 million a year just in Vermont and about $500 million lifetime. So it's working, but it gets tougher and tougher to add that next incremental employee. We're so often focused on finding the body and the bed, and now we're really focused on employers trying to afford that.
Right.
And just as an example, we looked at some of our rates. It's about $40,000 a year premium for a family.
Wow.
Okay, so that's $20 an hour add-on,
Yeah.
for a 2,000-hour a year employee. So it is right now shaping the calculus on who I hire, where I hire them from.
Right.
Is it outsourced? Are they full-time or part-time? So
Right.
the timeliness of this major lever and just premium expenses is really important. And thank you and welcome to VSET.
Well, thank you, and I'm glad everybody's here, but let me just give a few opening remarks. I am really concerned about how tough it is for Vermonters to afford to get through the month and pay their bills. And it's everything from groceries that are, so much more expensive than they were pre-COVID. Housing is just unreal. You look at it, I went on Zillow last night just to look at Burlington. I was shocked, really, because I haven't been in the housing market. I'm lucky. But healthcare is another one that is brutal, and it's really a tough expense for all our employers. I mean, $40,000 for a family, $20 an hour. That puts in comparison the argument that we had for years about a $15 minimum wage, and it's $20 for health insurance. So I think on all fronts, we have to be doing everything we can to try to make it affordable for Vermonters and Americans. This is not just a unique situation in Vermont by any means. But on healthcare, the most outrageous price escalation has been in prescription drugs. There's just no doubt about it. And it's really outrageous because of the fact that pharma, and let's start by acknowledging that pharma does some good things. There's medications that extend life and alleviate suffering. And in fact, my first wife, Joan, had cancer for 9 years, and we were real beneficiaries of some pharmaceuticals and local drugs, by the way, who we thought were terrific. But they're killing us with the price increases. And we pay in this country, as you all know, the highest for drugs of any kind than any other country. And why is that? And it's not because there's some magic here. It's because of the incredible pricing power that pharma has, in my view, is abusing. And think about this. First of all, pharma gets patents, which means they have a period of exclusivity because of their intellectual property. I support that, but then they abuse them by creating these things called patent thickets, by making a slight modification of the color of the pill or the delivery device, which is not anything that affects the health, but then allows them to try to extend that price exclusivity and keep out the generic market. The second thing that they do is benefit, which they don't acknowledge as much as they should, from an enormous taxpayer investment in the National Institute of Health, which provides core basic research. And what it has meant is that over the years, pharma has gone from allocating their profits more to dividend buybacks or dividends and shareholder buybacks and executive compensation than they do for research. And then third, and this is really what's significant, they have a market that's guaranteed and is largely created by the governmental policy. First of all, you got Medicare and Medicaid. I mean, we're all supporters of that, but it is a guaranteed buyer of the medications that the pharma comes up with. They have employer-sponsored health care, which is a tax subsidy, so that our employers get a little bit of they get a tax break on that, but that means that the employers are under the pressure to pay those escalating premiums. So you have this situation in our country where they get patents and abuse them. They have a guaranteed market with taxpayer support, Medicare, Medicaid, and employer-sponsored health care. And then third, they have They have the NIH taxpayer-funded core research, which is expensive. And then we don't negotiate. So what can we do? Number one, we can negotiate prices. And, that's a pants on fire kind of statement for the pharma companies. But finally, I've been working on this since I went to Congress in 2007, we've got price negotiation authority for 10 drugs, and we're trying to increase that. Every other country has that. It's called capitalism. You have a buyer and you have a seller, and they negotiate about a price. Under pre-negotiation, the pharma company would dictate the price. Second, we've got to reform the patent system. I'm for intellectual property. I'm for a time period during which you get the benefit of your intellectual property. I'm absolutely against extending that by gaming the system. And I have legislation in to do that. I'm getting some bipartisan support. And then third, we have to ask some basic questions. This new drug, is it called Ozempic? Yeah, weight loss, it may be good, but that could cost us over $1 trillion as taxpayers. Is that affordable? It's just not. So you have to have some rule of reason here where the public is protected, because otherwise something so profoundly important as your access to the health care is compromised. And what I find so hard is that when I meet a family where they've got somebody who really needs a medication, they will move heaven and earth to get it. And if that means getting a second mortgage on their house, if they have one, they do it. If that means cashing out the retirement, they do it. If that means getting an extra job, they do it. Because that's what we do for the people we love. But the pharma company takes advantage of that. And the price gouging that they've been doing for years it's really got to stop. So that's where I come from on this. I think it's urgent. It's one of the elements of increasing costs that is just so hard. And it's not just on our families, it's so hard on our employers. And in Vermont, I visit a lot of businesses. Vermont businesses care about the people who work there, and they want to have health insurance for them. And it's painful if they have to start dickering about what the coverage is and the eligibility, because they really, really deeply care. But you get up to that point where you can't afford it. So that's my introduction. And Nina, I guess you're going to moderate the discussion. But thank you all for being here.
My name is Ina Backus, for those of you that don't know me, and I work for Senator Welch here in the office in Burlington, Vermont. I echo his thanks for your participation today in this discussion, and what we really want to bring to the table are the experiences that you can speak to as employers or as individuals that support employers in terms of these high prices for prescription drugs and how those impact your work as business owners, as employers, what kind of decisions you need to make in light of those high prices. And certainly it's something that's punctuating our news feeds regularly. Just this week in Vermont, there was an announcement about what the proposed rate increases are for folks who are small businesses and individuals purchasing health care. And that proposed rate increase ranges between 9 and 19%. That's on top of what you're already paying for in terms of premiums. So we know that healthcare premiums, there's a range of impact in terms of prescription drug and how that factors into the premium, but at least on average in Vermont for those Vermonters who have Blue Cross, MVP, Cigna, 20% of the premium is made up by prescription drug prices, and that's growing year over year. And I think what we really want to talk with you about is what that's like year over year for you in your roles. So how about we start with Scott? And if you could, when you introduce yourself, say a little bit about what you do and where you work and
Absolutely.
how you, thank you.
Thank you. Yes, I'm Scott Brooks. I'm the CFO at Twin Crest Skincare. We're a third-generation family-owned contract manufacturer based in Winooski. We also have locations in Essex. So thank you for having our presence here. We appreciate it. This is a very important issue to us, so all of your words resonate very much. We've been facing significant cost increases in our plan with medical costs and prescription drug costs. Mm-hmm. Prescription drug costs account for 25 to 30% of our costs on an annual basis.
Yeah.
And like any other employer, we want to attract the best employees, and we want to pay them very well and offer great benefit packages.
Right.
So years ago, what we did was we went from fully insured to self-insured.
Uh-huh.
Okay, so we kind of cut out some of the insurance company stuff there and saved us some money. And we also joined a captive, which brought more savings to us. And just in 2022, we changed our pharmacy benefit managers. So that way we could experience some more savings on pharmaceuticals. And that's supposed to save us roughly 75% of that cost. But what we can't control is what you spoke about earlier,
Right.
The competitiveness, the patents. Those are things that we can't control. So I kind of feel like we've tapped into all the resources that we have, and this next step is very important to us.
Oh, thank you. How many employees do you have at Twin Crest? You guys are doing great.
We're doing very well,
Right.
yes. Right now, we have about 350 employees.
Wow. Fantastic.
So you shared that you were able to go from fully insured to self-funded, and you have 350 employees. For a business owner that doesn't have 350 employees and where self-funding is not an option, and purchasing in the exchange might be the only option, what does that look like, and what choices do you have to make? And maybe Al, you could speak to that.
Sure. So I'm Al Gobey, and I own Gobey Hospitality. I've also been involved with health policy for quite a while. So we have a couple of
Well,
restaurants.
no, at the hospital, so everybody
Yeah.
knows. So he had a major position at the hospital and had to deal with the cost pressures there and as an employer.
Yeah.
That's important.
Thank you, Peter. So, we're a small company. When I think about my company, 100 people, mainly seasonal, part-time, but we offer health benefits. And we don't have to by law. We offer it because we want to offer it to attract the talent that we need, and also because we care about our employees. So every year we look at the rates going up and say, is this still a good thing for the employees? Because we've moved to more high deductible plans. And what was a high deductible plan 10 years ago is now, the high deductible is kind of a misnomer. It's kind of like you need insurance for your insurance.
Mm-hmm.
Right.
And so, we every year get to the point where we're like, can we keep doing this? And we always say yes. But this is really tough. I just want to add one thing in the prescription drug kind of point. When you look at, pharmaceutical companies, 8 out of 10 spend more money on advertising
Right.
than
Yeah.
they do on research.
Right.
So this idea that research is driving this whole expense bubble,
Right.
I don't buy it. So it's really, we've got systems and structures and laws that have got us to where we are today. And if they're not serving us well, we've got to rethink them. And I know that's what you're trying to do.
Right.
And I think if with all the other inflation we're seeing, and we can't live with it as small businesses, if now is not the time to think through some of these things, I don't know when it is. So I applaud what you're trying to do.
Thank you. Wow. Go ahead.
Gwen, you work with some very small micro businesses and other businesses that are startup businesses. Can you talk a little bit about those, what business owners that you're working with experience, not just as small groups, but even as individuals trying to afford healthcare coverage?
Absolutely. Thanks for having me today. Nice to see you. I'm Gwen Pacalo-Hart. I'm with the Center for Women in Enterprise. We're home to Vermont's Women's Business Center, which is a public-private partnership with the SBA. And so we serve about 600 women entrepreneurs per year. Most of them have 10 or fewer employees, and they are the businesses that we love having in Vermont. They're the ones that keep our main streets alive and friendly and awesome. And the single biggest reason that we see women not taking the next growth step in their business, be that hiring that first employee, going full time, or usually there's an inflection point at a certain number of employees and what those employees do that women don't take because of healthcare. That is the single biggest reason that our in my humble opinion, our economy is stymied. No, it's not. Okay, but in this situation, yes, it's really stymieing our local economy.
Right.
And what that looks like is we have women who do not offer health insurance to their employees. 10 or fewer employees, it's not cost efficient, let alone what the employees are doing. Usually your first couple of employees are production level or entry level.
Right.
So we know we have a retention issue around employees. Many women are kept in very difficult situations in their families because they rely on their spouse
Yeah.
for those benefits. So again, not taking that extra step. And what we also hear a lot of is in specifically with prescription drugs, that they'll have an insurance policy on the exchange. I love what you said about you need insurance for your insurance. Most of our clients, if they carry their own insurance, they have the insurance for the insurance. No, they don't, but they need the insurance policy for the insurance policy. And when they do get sick, not only do we not have a good leave system and things like that, but that's, ancillary to what our conversation is today. But so often the prescription drugs aren't covered that they need to get well, aren't covered by the baseline plan that they're on. And we see people closing their business, having intensive medical debt, which feels ridiculous as someone who works in the, in the space and sees a lot of people. It seems like a ridiculous barrier to economic growth.
Well, thank you. Thank you very much.
Mike, can you share about your work over time with numerous different businesses and trying to transition from one to another and what that looks like in terms of launching a new project and how the costs of healthcare insurance impacts?
So your company is what, Mike?
So I'm a founder of Apraxis currently.
Yeah.
And we call ourselves a medication therapy management company. So we live and breathe these issues every single day.
Right.
The tagline is, after the prescription, pharmacy-based care. So we're dealing with all stuff pharmaceutical after it's been prescribed. I've been a tech employer in Vermont for over 20 years, and but with multiple companies and multiple startups. Some have failed, some have done well. But when I first started off, I philosophically believed that healthcare is a human right. So it's like, I'm going to provide healthcare benefits for every single one of my employers.
Right.
Totally covered.
Wow.
And when, in the early aughts, right, I could do that. The deductibles were in the $3,500 to $5,000 range. It's like, I'll cover that, right, in addition to the premiums.
Right.
Over time, the deductible got sort of out of control, as Al said.
Yeah, Al said, yeah.
Been able to cover the premiums, although that's gotten crazier and crazier. But I basically have had to sort of cap that, okay, I'll go up to the deductible after 5. And so there's this window by which the donut, which has grown significantly for the people that I try to hire. And being in the tech space, right, it's tends to be young people. So they tend to be a little bit healthier. But but it's also when people are starting families, right?
Right.
It was great to be able to sort of support people starting their families in the beginning. And now they're at risk, right? If they're going to have a kid, it's one of the most expensive things for a young person. So it's been frustrating to experience that over the 20 years.
That is so frustrating because, you start out, and I think you speak for most employers in Vermont.
Yep.
You want to take care of your folks. And
Yep.
what's more important than the security that comes with knowing you got health care coverage?
Exactly.
And then it becomes impossible because it's so expensive. You have absolutely no control over it.
Yep.
None.
There's a guy who's on our board, great guy, love him, very, very smart. He works for Alliant. He comes from Vermont, worked at Porter, was a professor at Albany Pharmacy. He now is in the benefits management space down in Georgia. And he said last year, across the board. It's one of the biggest benefits managers in
Yeah.
the country. Big and small plans experienced medication increase of 30%.
Oh, man,
1
that's
year.
amazing. And, you know, Scott, I'm just thinking about you, you know, you have a bigger company, so you have the capacity to take some steps that you took to help deal with the cost. But now you're still staring at these constant increases in the premiums, and there's no more runway for you to take steps that is going to abate on this. I mean, the pricing power is there, continues to be there for farming. Anyway, go ahead. But,
So, Mike, what's it been like transitioning from one business to another? How do these costs impact your ability to be nimble?
It just means that I understand that the cost of starting up a business
Yeah.
is that much more expensive.
well, you can't take, I mean, I can't imagine if I was starting a business and then it was going to be $20,000. I'm making a commitment to 5 employees. That's $100,000. I mean, that's not an option. You know what I mean? It's just you're priced out of it.
But it's not an option, meaning
Yeah.
you can't get talent if you
Yeah,
know, so, you know, it's
you're stuck.
a tough
Yeah.
position.
Or do you use more part-time,
Yes.
fractional, out of state, maybe you're in a different location that might have,
Yeah.
I mean, that's.
So we have a
that's how you
fractional,
manage
we
the
have a fractional
workforce.
CFO, we have a fractional compliance officer. Yeah.
And I think that's the scary structural thing is the calculus has changed between last year's big increase, cost of living for, you know, COVID, post-COVID
Right.
years, and then now with the proposed small business plans going forward, it's like, whoa. I need to make the numbers work for everybody. One, to protect the benefits that are afforded the current team and employees. So as you look incrementally forward, you're going to be, I'm fearful of less full-time,
Yeah.
more part-time unbenefited. Okay, and there's a component of the workforce that embraces that and wants that fractional or independent lifestyle too, but it also prejudices, I think, a lot more young people that are in the workforce for the first time or magically turn 26 or 27 when they have to get off their parents'
Right.
coverage. And
Right.
again, that's happening in real time. It's sucking up more of the available pie, so you're taking professional development dollars
Yeah.
to pay your health care
Right.
as an employer. So
Well, and it puts downward pressure on wages, right? Because if you're, you know, the full package is what you have to look at. So if you were going to have to pay $20,000 for a family policy, that's going to put a lot of constraints on your ability to provide that employee a raise, right?
I wish it was 20,000 for a family policy.
40.
Yeah, close to 40 for some of them.
Okay.
So
But also, I think that for small businesses and large businesses, we're seeing so many cost pressures
Right.
to include labor costs, meaning wages.
Right.
So the option of reducing wage increases to pay for something else, like healthcare or anything else, isn't there right now. So property taxes are going up, healthcare is going up, wages are going up, and small businesses are right in the vortex of trying to figure out how to make a bottom line with all that.
Wow. Seth, you represent, you know, your Roundtable represents a lot of bigger businesses. What's going on there?
I mean, a lot of them have gone the direction that Scott was talking about. You know, if they have the economies of scale, they're gonna try and self-insure. They're gonna find different ways around it, but
Yeah.
the pressure still exists. I mean, I think Al made a great point. It's really the total environment of affordability that we're talking about. It's the housing pressure, and that's not independent of the healthcare costs, right? I mean, our property taxes are going up because our education spending is going up. In part, that's driven by healthcare costs. It is a tremendous pressure on the ability to hire, the ability to expand, thinking about, you know, if you're a small business looking at the next steps, it's a monster in the room. And it just cannot be avoided. And yes, you may not be legally mandated, but talk to anyone who's looking for a job right now, and if healthcare is not included,
You can't.
it's a non-starter.
Right.
And that's, you know, David's point at the beginning is a good one. It's $40,000 for a family. I mean, we represent large employers all across the state, but we are also a small employer as the Business Roundtable. I see it every day when I look at our budget. I mean, this is a real cost. I have a young family.
Yeah.
I'm driving it.
Right. Yeah.
We're joined by a couple of folks from VSET. Do you have any observations that you want to share also on the topic? You're please welcome to jump in.
Yeah, I mean, like Seth, I also have a young family, and I actually am trying to start my own business and changing my role at VSET a little bit and shifting to part-time, which means my healthcare goes away, and that's absolutely terrifying. And I think there's many people that don't have the support or my spouse's insurance to go on to be able to take that risk. And VSET's been incredibly supportive of that. And but I think there's many people in my shoes that would start a business, like to Gwen's point, or like have a side hustle that they want to take full time, but it just doesn't make any sense, especially if you have young children or you want to have kids. It's just way too much of a financial risk, and like up front, that is just insurmountable. Like you can't do it. So that scares me, because we're also talking about population decline. People aren't having kids anymore. It's like, well, why do you think that is, right? So I think that's what scares me, is that it's inhibiting so much growth. Population, people starting businesses, people scaling their businesses. We see it every single day at VSET. And just feeling it personally now too is just a whole different level. It's really the way you look at your life and your family's life and the stability you have is entirely different.
Yeah. Do you want to add anything?
Yeah, I'm Nicole. I just joined VSET full-time in November, and I graduated from UVM last May. So I still am under my parents' health insurance. Although,
By the way, that was one of the best things that we put in the Affordable
absolutely.
Care Act. Yes.
Yeah,
Eddie Markey and I, with our,
brilliant, yeah.
it was so helpful.
yeah, one thing I
Because
will.
you'd be struggling.
Oh
You
yeah.
got health insurance now, and you're
Well,
getting started.
VSET was kind enough
Yeah.
to offer it to me. But I mean, I was just gonna say, like a lot of my friends, one, they don't live here anymore because they couldn't find a job, but they also couldn't find a full-time job in Vermont. Everything they wanted was part-time. A lot of the positions were part-time, even though the work was definitely could have been more than part-time. So I just want to attest to that point that you guys made of companies are trying to work through it, but my friends could not land a full-time job for their life, and I was, and we have UVM and so many companies being like, stay in Vermont, students, but there's just not opportunity for us to do that.
Yeah.
Or like we talked about, the health costs are so high that they're offering salaries that are $30K, right?
Yeah.
And it's like, even for a 23-year-old, that's not a livable
You
wage.
can't pay your bills.
Yeah.
What's really horrifying for me is that this is not necessary. A lot of times these things happen and you think, well, that's the way it is. Nothing we can do. Well, the deck is totally stacked against everyday people and businesses. And when in terms, I'll just go through those things that Pharma has been able to accept. We're the only country, okay? We're the only country where our government basically does not provide protection for the consumer when it comes to prescription drug cost. All other countries understand that if you're sick and you need a medication, you've got to be able to get access to it, and it's got to be affordable. And the argument that this will kill innovation, as you said, Al, it's sort of a lobbyist-driven but not data-driven argument. So what we should be doing here is what other governments are doing. Number one, we're the bulk purchasers, so you get a lower price per unit, right? I mean, if you go to CVS, I'm gonna go buy some aspirin later, I'm gonna get a big bottle and look at that unit price, right? We can't do that. We have to pay the price they demand. And we cracked that. That's what's so significant about our legislation last year, but it's 10 drugs, and that's gonna expand. But the principle of negotiation, where a buyer gets to negotiate with the seller, let's do that. And then second, the patent system has been totally abused. And that is completely outrageous because we're turning market principles upside down. Market is based on competition, not protection. So you've got governmental protection that are sustaining these high prices. And then, third, as I mentioned, all of that taxpayer research goes into the foundation of so many of these drugs that then get marketed and manufactured. There's a real financial contribution as an investor that all of us as taxpayers have made. And shouldn't we get some credit for that? So, there's a lot of us working on this. We have made some progress, but it's not enough. And this is the tip of the spear on the healthcare. And healthcare is so essential. All these other things that are price pressures, they're real. It's creating a lot of anxiety for working class people. And I think I gave you my little story, but I think about how it was for me. I could take a chance. It would be like you starting a small business because I just didn't have this overhang of unaffordable health insurance or unaffordable housing. And so I took a low salary, right? But I had low cost. At the end of the month, I paid my bills. My checkbook was balanced. And, what I find with people is that they don't mind us, having a modest start. They just want, and they don't mind working hard. They like to work hard. Yeah. But that has to mean that they're a half a step ahead tomorrow than they were today. And they're not, just falling behind, no matter how hard they work. So, this healthcare is, it's amazing to me listening to you. The success you've had at TwinCraft, and now you have to deal with this, and all your folks, and now, you didn't even get into the price pressures this puts on our hospitals where they have no control, big as they are with the big budget they have. But that's a real price pressure, and that's a real constraint for our hospitals too, right?
It absolutely is. And I would also say that after all the years of being in the state and healthcare, it puts an incredible emotional pressure on our providers.
Yeah.
It's almost like we blame them and we don't know why,
Right.
because things are expensive. And, when you think about 8,000 nurses that work within, 5 miles of here,
Right.
it's just not right. We shouldn't
Right.
blame, providers should be proud that
Right.
they are the most incredible providers of healthcare in the world. And, this is, we don't understand why these prices go up when we're, just running a restaurant, but I think
Well,
you've got it.
No, those are things that are within our control to change. And it's inexcusable that we're not changing them. So, I'm going to continue to be as determined as I can. We have a hearing in the Judiciary Committee on legislation I have about the patent thickets. And there's a lot of opposition to it, and it's all monetary. They've got a sweetheart deal and they want to keep it. It's as simple as that. But we've got to speak for everyday people and everyday businesses. So we're looking forward to that. And Senator Durbin's given us the opportunity to have a full-scale hearing on this.
Well, I'm hoping you have a moment in time, like on the board over here, the
look at this, yeah.
two diabetes drugs that are being used for weight loss that we've been reading about. And it's shocking that it's 90% less in Germany, an advanced aging population sort of country. It's shocking.
Right.
Not that I want to go to war with Denmark, but the Danes should be able to help us out here, I hope. But the other thing I'm hopeful of is
Germany has protections.
Yeah.
That's the difference.
The other thing-
And the manufacturing, that's Lilly, right?
yeah, and the other thing
They've had record profits.
I'm hopeful that your colleagues and those in Congress will feel more comfortable trying to make a change here, because these two drugs are blockbusters. There's unprecedented demand. States are removing them from programs, North Carolina and
Right.
others. So you actually have voters that can't get what they want on a particular drug that's not a narrow,
Right.
very narrow disease-specific chronic condition thing. So the masses can't get what they want. And even when they can get it, they can't afford it. It's changing the composition and the calculus around full-time employment with benefits or not. And again, the numbers are shocking enough that
Yeah,
I'm
I think
hopeful.
we should use that in our hearing, I think. Don't you?
We got it.
Do we? Okay. Well, I want to
thinking
thank you. I
right.
don't want to keep you too long. I really appreciate you coming. because the thing I worry about is that anxiety that everybody has is legitimate. But we've got to have a response that's effective. And, I think about the nurses, and during COVID, it was so hard, and all of us were staying home. They had to go wade into the most infection-ridden place in the world. But then when an everyday citizen has to go to the hospital, they're scared because they're terrified about what the medical debt will be. So the person who's really anxious doesn't always act appropriately. They get angry at the person who's in front of them, and that's the nurse. And that's, I guess, what you're talking about.
That's right.
So that's really tough. And then our employers who are trying to make decisions, it's a touching story about you getting started, and before you even knew whether you'd be successful or not, you made a commitment. You were going to take care of your employees because healthcare is a right. So you did that, and then it's grinding.
And I'm not
grinding.
unusual.
Pardon me?
Most employers, I think, feel that way.
And
They
that's
really
my
want to do
experience.
right by their
That's my experience. We're kind of small here in Vermont, and it's a family type of deal for most people, even the bigger firms. But if the load is getting heavier and heavier and heavier, at a certain point the back breaks. And but the good news here, we can do things about it, but we've got to get the support. And
Do you think there's bipartisan support for the anti-patent wicket? I could see that being
it's
a little
really,
tricky.
really tough. I
Yeah.
think there is some bipartisan support. Again, when we're having this conversation here, this conversation could be going on in the reddest district in the country, because the people that my colleagues represent all are having the same situation that you're talking about on behalf of your employees, okay? So that's where there's some support. And I get frustrated sometimes at the political system where we don't just put the verbiage on hold and say, wait a minute, how are folks doing, how are your employers doing where you live, who you represent, with the cost of healthcare? Because then you're having a conversation about, all right, what do we do about it?
I have one suggestion that I think that will be completely nonpartisan in terms of both sides can get on it, which is that take cost consideration under review at the approval process.
Absolutely, absolutely.
And I think everyone would get on board with that. Patents, I can see, become a little bit trickier. But
Well, but what happens is, when these pharma companies set the price, they basically
Right.
do an incredible amount of studies to see how much they can get away with. And effectiveness has to be a part of it. I mean, you can't have something that costs more than anybody can reasonably afford, and whether it's healthcare or housing. I mean, these are real structural problems, and it doesn't have to be this way, but that's why we've got to change some things in the laws that protect everyday folks and everyday businesses. And we can do it. They're there. The solutions are, they're there. And that's what I'm going to push for. But it's very meaningful to me to hear from you, because it's so real, and we want to keep that connectivity in Vermont where people have a sense of confidence that if they take a risk and they do it right and they work hard, they got a shot, That's what you're doing.
Mm-hmm.
Yep.
Yeah.
Well, thank you.
Thank you.
Thank you very much.
Yeah. No, I really appreciate it.